হ্যাঁ যা যাবি না পাও বাতাস যাবি না দক্ষিণে যা উত্তরে যা যা যাবি না পাও বাতাস যাবি না যা হ্যাঁ
ভাই রাহেলা তোমরা কেমন বাপ মা ছেলেটারে এরকম করে কষ্ট দিচ্ছ কে?
অনেকে পাও বাতাস লাগছে, খালি ঘন ঘন নিঃশ্বাস নেয়। কি করবো কন?
কি করবো মানে? কমিউনিটি ক্লিনিক আছে না, আসমত চাচা জমি দিল, সেই জমিতে সরকার কমিউনিটি ক্লিনিক দিছে, প্রশিক্ষিত সিএইচসিপি দিছে। কি জন্য? কারো কোনো অসুখ বিসুখ হইলে প্রাথমিক স্বাস্থ্য সেবা আর পরামর্শের জন্য আগে তো সেখানে যাইবা। রাহেলা চলো, চল ভাই চলো না আমার সাথে।
আপনি বসেন। বসুন। লক্ষণ দেখে মনে হচ্ছে মারাত্মক নিউমোনিয়া। ভয় পাবার কিছু নেই, আমি ওকে বড় ডাক্তার দেখানোর জন্য উপজেলা স্বাস্থ্য কমপ্লেক্সে রেফার করে দিচ্ছি।
আবার উপজেলা স্বাস্থ্য কমপ্লেক্সে যাইতে হইব?
যদি সাধারণ রোগ বালাই হইতো তাহলে সিএসসিপি তোমার ওষুধ দিয়ে দিত, মানে ওই রোগটা একটু জটিল তো, এই জন্যই উপজেলা স্বাস্থ্য কমপ্লেক্সে রেফার করা হয়েছে।
চিন্তা করবেন না, এই রেফারেন্স স্লিপটা দেখালে উপজেলা স্বাস্থ্য কমপ্লেক্সের ডাক্তার গুরুত্ব দিয়ে আপনার বাচ্চার চিকিৎসা করে দেবে।
স্বাস্থ্য কমপ্লেক্সে যাওয়া নেয়া তোমার কোনো চিন্তা নাই, ওই কমিউনিটি গ্রুপ বা ওই সাপোর্ট গ্রুপ আছে না, এরাই তোমার যাওয়ার সব ব্যবস্থা করে দেবো। এই যে আমি তোমার কাম করে দিচ্ছি।
বুঝলেন, চীনপুরি বাউ বাতাস এইসব পক্ষী চক্কির দিন শেষ, এখন কমিউনিটি ক্লিনিকের বাংলাদেশ।
For the poor and underprivileged rural people of Bangladesh, the government has already established 13,500 community clinics in the country on the lands donated by the locals. The good news is, today, one can find at least 3 community clinics in each union all over the country. Community Clinic of Bangladesh is now the largest private-public partnership in rural healthcare initiative in the world. In every corner of the country, from inaccessible hills to storm and tidal bore-prone areas, how or riverbank areas, no one is deprived of the healthcare services from these community clinics. Bringing healthcare services to the doorsteps of the people was a dream of the father of the nation, Bangabandhu Sheikh Mujibur Rahman, which is being successfully implemented by his daughter, the Honorable Prime Minister Sheikh Hasina.
I call upon you to come and get the healthcare services. The Community Healthcare Centre is dedicated to provide services to you.
On an average, a total of 40 service seekers are receiving various service free of cost from community clinic during 9 a.m. to 3 p.m. every day. Since its revitalization in 2009 till December 2017, people of rural Bangladesh have received various services through more than 650 million visits. 80% of them are poor and underprivileged women and children. And sometimes numbers say it all. The Honorable Minister for Health and Family Welfare of the Government of the People's Republic of Bangladesh, Mr. Mohammad Naseem MP, patronizes this program.
After liberation, Father of the Nation, Bangabandhu Sheikh Mujibur Rahman, first introduced health complex at Upazila level. Following his path, after a few decades, Bangabandhu's daughter Sheikh Hasina introduced community clinic concept to take healthcare to the doorsteps of the vast poor and underprivileged population at the remote and grassroots level in 1998. Millions of mothers, children, youths and elderly people of our rural areas can't afford to go to Upazila Health Complex for seeking even general health services, and then there is no question to go to the district. That's why Sheikh Hasina, daughter of Bangabandhu, has brought the health services to their doorsteps. Today, wherever you go, even in the remote areas, union or ward, you will find a community clinic. From morning, mothers go there and wait in the queues. They know they will get health care and medicines with due attention. It's the day-to-day scenario of rural Bangladesh, and they are very much familiar with it. The villagers of our country now have easy access to community clinics. They need not to go to hospital or any private clinic. Rather, needed health facilities and qualified and trained health professionals have brought such quality services near at their hands. This innovative and successful concept of healthcare, medication and antenatal care to pregnant mothers of the mass and poor and marginalized group of people has been admired by the global community.
The biggest success of the community clinic is it makes rural people to think about what to accomplish for their healthcare needs. To ensure people's participation, a community group and 3 community support groups, each comprising of 13 to 17 persons, have been formed in every clinic's catchment area. Besides managing and maintaining the clinics, they also identify pregnant mothers, newborns and critically ill people through social mapping. They are assisting people to go to the clinic and also to reach higher-level healthcare centers.
All over the world, government does not do the business. It is the people who will do the business. Government is there to support the people. What does it mean by community involvement in case of community clinic? It simply means to ensure the health care. Community will ensure the service. They will maintain the facility. They will ensure so that the facility will have medicine, manpower, and they will inform the government. If there remains any problem, such as it is not running well, shortage of medicine, or community health care provider is not giving service properly, when the people will look after these issues, then automatically the service will improve. Community donated the land, they are getting services and they are the service taker. They are the beneficiaries. As they are getting benefits from the facilities, so they look after and love community clinics. That is why it is being successful.
As one-stop service center, the services people are receiving from community clinics are antenatal care ANC and postnatal care PNC, symptomatic treatment of general diseases, reproductive health care and family planning service, nutrition education and micronutrients, health education for adolescents, symptomatic treatments and advice for elderly people, vaccination for mother and children, identification of physical, mental disability and autism and referral service. Community clinic also has referral service for emergency and critically ill people. It is a special edition of community clinic. It ensures need-based and appropriate health treatment.
এখানে পরিবারের
In Bangladesh, mainly the males contribute in household income. Females in our country are also being involved progressively in income generation sectors. They have been working outside houses too. But still, in reality, involvement of males in working areas is much more than that of the females. When the males work outside, the females stay at home, and in Bangladesh usually they look after the children. While the male member of a family doesn't stay at home, and if the children, females, adolescent girls and boys get ill, the females or mother can bring them to the nearby community clinics. Here they don't feel insecure, and at ease they get the required services. But if the community clinics wouldn't be established near their homes, they didn't get the services. They would have go to the hospital or private clinic at town or buy medicine from a medicine shop, and if so, their male partners would have to accompany them and lose his incomes. In true sense, for this reason, community clinic is so popular among the villagers. Lots of survey has been conducted by our local and international organizations, including World Health Organization. Result of every survey showed 85 to 90% or even higher number of people are satisfied with the services of community clinic. We never have seen less than that. Community clinic is a program under public-private partnership. Community donated land, government constructed the infrastructure, deployed service providers, supplied medicine and logistics. But management is done by both the community and government through community group formed with representatives from different segments of its catchment population, headed by elected Union Porishad member. Community support groups are there. The group members supervise and monitor community clinics. Union Porishad chairman is the chief patron for all the community clinics of the unions and visits community clinics regularly. Any problem locally solvable, he resolves that. Starting from our Honorable Prime Minister, Honorable Minister, Honorable Parliament members, high officials of health departments, including Director General of Health, we all supervise and monitor community clinics and follow up online reports. Besides this, our health managers of district and field visit a prefixed number of community clinics and send the reports to the head office. We try to solve any problem if found in the reports.
উন্নত ব্যবস্থা করতে হবে, কোথায় কি সমস্যা আছে সেগুলি আমরা দূর করার চেষ্টা করি।
The Honorable Prime Minister, Sheikh Hasina, has been awarded the UN Millennium Development Goals MDG Award in 2010 for reducing the rate of under 5 child mortality in this country, and South-South Award for Digital Health for Digital Development in 2011. The government is now working to achieve Sustainable Development Goal SDGs. Community Clinic is an example of public-private partnership that has been wiping away all health-related worries of the people in the remote areas and changing their lifestyle and quality of life. Sheikh Hasina's innovation. Community Clinic saves lives.